these are some natural things you can do for overactive bladder before you try medication. Overactive bladder is when the bladder contracts spontaneously and you have a sudden urge to go to the bathroom. If you urinate 8 or 10 or 20 times a day, you probably have overactive bladder. Some women experience a bladder contraction, an urge, and they actually urinate. This can absolutely disrupt your life. Your bladder fills with urine, and then it sends a signal to your brain that you have to urinate. You go to the bathroom and you sit on the toilet, and then your body tells your pelvic floor muscles to relax and your bladder to squeeze. That squeezing pushes the urine out. But if you're just standing there and the bladder starts squeezing before you're in the bathroom, that's overactive bladder. Lifestyle changes to make this better would be to avoid caffeine, alcohol, artificial sweeteners, spicy food. Pay attention to your body and see what irritates your bladder more. Kegel exercises or physical therapy, which strengthen your pelvic floor, this will actually help with overactive bladder too, because it puts the bladder back up and it helps the bladder not drop. And the bladder dropping sometimes can just cause contractions. Another solution is bladder retraining. What you do is you schedule how often you pee. Instead of running to the bathroom every time you have a bladder contraction, you allow your bladder to fill up more. It's uncomfortable, but if you wait an hour or two to use the bathroom, your bladder will stretch, and that stretching process will decrease the amount of contractions that you have. And this is one that is very simple, and I think that this often is the most important one. Drink less fluids. So many people with overactive bladder that come to my office are also carrying around a huge bottle of water. They're making sure that they get their half gallon or gallon a day. As a urogynecologist, I can tell you this, that even though it's common wisdom that you need to drink a certain amount of water every single day, the truth is that if you have overactive bladder, drinking that water is not going to be good for you, but it's going to be disruptive. Particularly avoid drinking late at night, because getting up in the middle of the night to use the bathroom is miserable. And understand this, that when you drink a lot of water, some of it will go out of your bloodstream, your legs will become kind of swollen, and when you sleep, when you lay down, that fluid will go back into your bloodstream. So we actually generate most of the urine at night anyway. If you suffer from overactive bladder, before you try medications, try these simple solutions. Change your diet, do some bladder retraining, and limit the amount of fluids, because your bladder telling you have to go when you don't have to, nothing is more miserable than that.